Cardiopulmonary Resuscitation, CPR, carries out when the pulse and the breathing of a person stops. CPR procedure is necessary in diverse cases, like in an accident, drowning, choking, and the most common, a heart attack. In agreement with official statistics of the American Heart Association, 1 of every 1,000 people dies because of heart attack. The blood's fluid stops, the victim faints away, and in a few minutes, a cerebral spillage is registered. The death can happen even in 15 minutes. The pain in the chest is the principal symptom of a heart attack, but in many cases, the pain can be soft or even non-existent, because it is necessary to give attention to other symptoms like sweaty, cold, humid, and pale skin, lacking in breath, nausea or vomit, rapid or irregular pulse, dizziness or faint. If some person shows some of the symptoms, it is necessary to act at once. The first step to be sure if the person is conscious is giving him some small hits on the shoulder and asking loudly, "Are you okay?" If the person does not answer, call immediately to the local emergency number. After that, you should clean the area where the victim is laying down, and later you can initiate the first step of the CPR. Place your hand on the person's forehead and press firmly the head backwards. Place the fingers of your other hand under the jawbone and raise it towards ahead. Place your ear closest to the person's mouth and nose. Watch if the person's chest rises and goes down. Try to feel if the air is going out of the mouth or nose.
So these are two important signs for us. Pulse and respiration means breathing. If you don't check, you will apply wrong. Applying wrong means if there is heartbeats and you do CPR, the patient may have a dangerous situation. The heart will stop. So we must check before.
Using the thumb and the index finger of the hand placed on the forehead, press and close the nose with smoothness. This prevents that the air escapes from the nose. Take air deeply and place your lips on the person's mouth, doing a hermetic seal that prevents the exit of the air. Give 2 slow breaths in the course of 1.5 and 2 seconds. Take air after every breath. If the chest does not rise and goes down in every breath, it is possible that the airway may be closed. Accommodate the head and try the procedure again.
Mouth-to-mouth resuscitation or mouth-to-mouth breathing is the first step of cardiopulmonary resuscitation. When you apply mouth-to-mouth, you must have, number 1 is open airway. Number 2 is effective mouth-to-mouth breathing. These are 2 precautions. There is another one we may have to be attention. If there is a spinal injury, means that's head and neck here, trauma, or the vertebral column, you must be very cautious in moving the head.
Begin with the chest compressions. These compressions press the heart between the vertebral column and the breastbone to stimulate the heartbeats. Place your fingers in the low part of the ribs. Slide the fingers through the edges of the thoracic box up to where the ribs join, and there you find the breastbone. Place the back part of your palm hand on the average part of the breastbone and place the other hand on top of the first one. Rapidly and strongly press down the breastbone between 1.5 and 2 inches. The compressions must be constant and equal. This means that the use time must be equal when you press than when you slacken. This allows that the blood should return to the heart before you make the next compression.
Chest compression, we actually compress the lower third of the sternum. If you get downwards, you will compress the very small cartilage, will be fractured if you press it, and maybe a damage for the stomach, which may lead to internal hemorrhage. The other thing, when you go to the right or to the left, you will fracture the ribs, because it is not the ideal place of compression.
Do 4 complete cycles of 15 compressions and 2 breathings and evaluate again the person. Check the pulse of the carotid artery during 3 to 5 seconds. If there is no pulse, continue with the complete cardiopulmonary resuscitation. If there is pulse, examine the breathing. If there is breathing, accompany the person until the paramedics come.
All people must learn CPR, because CPR is life-saving for any person or any human. At any place you may face emergency situation needs a CPR, and it is easy maneuver, easy technique, but CPR equals life. So we must know CPR to save lives.
Susie, are you okay? Are you okay? Do you hear me?